Welcome to this session on Analyzing Health Policy. I'm Dr. Donna Gurley. A policy analysis provides informed advice and options for a client based on their values and their power to implement a solution. Another way of describing a policy analysis is to define a specific problem, give detailed information, provide alternative solutions to the problem, and ultimately come up with one recommendation that the stakeholder can implement. So I've described what a policy analysis actually is. Now let's define specific terms so that we have a common understanding of them. Client-driven means that this analysis is prepared for a person or group of people who have a vested interest in the issue. Data is presented from both sides of the issue to inform the decision. Options are given based on the data and what is important to the client. Typically, one option is recommended. And this recommendation is grounded in the stakeholder's principle or values, which means that they have both the resources and the political capital to implement the recommendation. Two models of policy analysis are given in the readings. The rational model strictly takes into account the evidence pointing to the correct decision. It's based purely on facts or data. The political model includes the evidence or data, but additionally considers the climate surrounding the issue. In other words, if a particular option is recommended, will it be supported and able to be implemented? In addition, the political model considers other issues that could make or break carrying out the recommendation. There are several examples in the readings, and I'd like to illustrate this process of analyzing policy with my own real-life example. When I was the Environmental Health and Safety Officer, the issue emerged as to what to do with pharmaceutical wastes that were generated daily by our healthcare system. The then current practice was to dispose of unused meds down the drain or into a sharps container. However, more and more research was emerging that these disposal practices were contaminating surface waters, and drugs were starting to show up in the drinking water. Based on my assessment, the policy climate was changing, which meant we either needed to step out and confront the issue or wait and be handed a solution that didn't meet our needs. I needed to make recommendations based on the values of the healthcare system, the cost of the various recommendations, none of which were going to be cheap, and how complex the implementation would be for healthcare workers. My team and I put together a statement about the problem so that leadership could understand the issue from both sides and what was driving both the problem and our recommended solution. Forming the problem into a question, which one listed best describes the issue? First, what should we do about pharmaceutical wastes? Or, second, what types of pharmaceutical waste should be included in a disposal program? The first question requires a yes or no answer, and likely the answer would have been, we don't need to do anything. The second question really drives action. Which wastes do we need to include? Because we knew that the values of the organization embraced moving forward with a disposal program, the second question was the obvious one to ask. The next step of the policy analysis needed data in order for the decision makers to fully understand the issue of pharmaceutical waste disposal. So, we included information like the types and quantities of pharmaceutical wastes produced by healthcare and at our specific institution. We also described the types of hazards that these wastes pose to both people and the environment. This factual data, along with sources cited, helped to strengthen our position towards action. The next step was to describe the landscape for the decision makers. We had to detail what was motivating this change. For starters, the political environment was rapidly changing, and lawmakers in California were in favor of approving policy that would require healthcare organizations to implement a pharmaceutical waste program. With every change comes a price tag, and we needed to calculate what that economic impact would be to the organization. We also had to describe the risks to employees of current disposal practices, primarily through the extra handling that they were required to do to waste a pharmaceutical down the drain. Ultimately, we had to paint a picture for the various stakeholders and what their positions were. For example, the policymakers in Sacramento were in favor of changing policy to require a disposal program. The disposal company certainly was in favor because they would make more money. But at the same time, they were very interested in partnering with us to use our organization as a best practice example for their other clients. And the organization was in favor of reducing risks to employees and the environment, and ultimately reducing their liability because of these risks. With the problem clearly stated, background information given, and the landscape articulated, the next step was to describe options for the organization. We had to determine which wastes would be included and how they would be collected at the point of use, which is the patient's bedside. So I want to describe this for you so that you can see the magnitude of the issue. We had IV bags of medication, injectables that typically had some liquid left over, pills which were usually given directly to the patient, chemotherapy which was classified as hazardous waste, TPN which is liquid nutrition and usually has heparin which is classified as hazardous, patches that contained either nicotine or a narcotic, both of which were considered controlled substances, and there were IV bags of saline. On top of this, we had to de-identify a patient's name or ID number for HIPAA compliance. So when we started looking at the magnitude of the types of wastes, it seemed like no matter what we did, we would violate a law. For our recommendation, we asked for a pilot study that would be implemented in 3 specific patient care units and the pharmacy for 90 days. This included containers, an education program for the staff, a collection schedule, and lots of input from the stakeholders, including nurses, pharmacists, housekeeping, and vendors like supply companies and our medical waste vendor. When the 90 days was over, we decided to continue for another 30 days to refine the program and collect data for analysis. Ultimately, we ended up with a great pharmaceutical waste program that met the requirements of many policies, including HIPAA. Even with implementing the recommendation of the program and waste to be included, it still required refining once we rolled it out to the entire organization. But we approached the issue with input from all of the stakeholders involved and kept the decision makers informed. This program is still considered a successful, best practice pharmaceutical waste collection and disposal program at a large healthcare system. I hope that you were able to see how a policy analysis can be applied even to a healthcare organization. I'm Dr. G. Thanks for watching.